That's quite scary. Why do you see people out and about who have lip fillers done and you can tell at 20 paces the lips look too full, they look really unnatural? There's a lot of reasons for this. Number one in my mind is the practitioner who's doing the treatment. Ideally, you need somebody who's medically trained, so be that a doctor, dentist or a nurse, who've spent years and years studying anatomy and who understand what's happening with the face. And they don't just dive in and inject any old product in the lips. They look at your facial proportions as a whole and whether it is a good idea. So I think the practitioner bears a lot of responsibility. They're the one who is controlling the hygiene of the procedure. They're choosing the product. So products vary from being very runny, soft hyaluronic acid products to being thicker and thicker. And also they come at a full range of being very cheap without any idea of how they're made or where they're coming from, to the more expensive products that absolutely, if they're clinically proven, can have a much greater result and a much longer lasting and more safe result. So I think the practitioner is number one, the product choice is number two. I've been doing aesthetic work since 2007 and I've been a qualified doctor for 34 years. I'm still learning. Processes are still evolving and I never want that to change. And it's a privilege to do this work, but it takes effort and study to really be sure you're doing the right treatments, to know where the blood vessels are, where the nerves are, what are the safety factors, and how can you keep it as safe as possible, prevent complications, diagnose the few that do occur, and manage them appropriately. Would I go to somebody's kitchen to have a root canal work done by a non-dentist or somebody who's had a day's training? Absolutely not. And yet people are willing to go to non-medical injectors to have their lips done or other treatments. I understand price is a factor, but really it's your face and you've only got one and you do need to put it in safe hands. And from my point of view, that should be a dentist, a doctor, or an aesthetic nurse who really commits to safety and study and has your best welfare at heart. One of the issues people talk about is filler migrating, and that's where, for example, fillers being placed in the lips, but it can migrate to above the lip. In my mind, most of this is just incorrect placement in the first place. So if you do the lip procedure and you do it carefully with the right choice of product and you stay in safe areas, then you shouldn't really get migration. Is a product that you inject up here going to move down here? Absolutely not. But a lot of the bulkiness we see here above the top lip in people who've had fillers is just too thick a product, not the right placement, and they're really getting a shelf out here which doesn't look very attractive. And if the product's too thick, the lips can look really rubbery and not elegant or soft. The other thing is really, try and choose that practitioner carefully. If you get something like a procedure, it may last a year, but some of those products can last years and years. So you really want to be safe having them done. I hope that's helpful. Please send us more questions. Take care. Bye.